Thank you for joining us this morning. My name is Sarah Judd-Lamb. I'm the Executive Manager, Policy Development and Research at Carers New South Wales. We are speaking to Dr Lukas Hofstaetter today, one of my colleagues, who will share some of the great work that he's been doing on Respite. As you can note on the slide there, unfortunately, Kim Whitmore, PhD, who is our intended guest speaker for this session from the USA, has had a family health emergency and has had to postpone. So we'll be looking to reschedule with her in January, hopefully. So just some background about the series before we get into the slides. So the Innovations in Respite webinar series is a new initiative of Carers New South Wales. And our aim with it is to bring inspiring respite projects and models from across Australia and overseas to a wider audience to inspire innovation. We had our first session last week that some of you may have joined. That was a conversation with Kerry Donaghy from Shared Care Scotland's program Respitality. Before we get started formally, I want to acknowledge the traditional custodians of the lands that we're all joining from today. Lukas and myself are in our head office in North Sydney on Gorigal land, and we extend respects to elders past and present and to all Aboriginal and Torres Strait Islander people. Carers New South Wales, if you're not aware of us, we're the peak non-government organisation for family and friend carers in New South Wales. And we run a lot of these kinds of events, building awareness and capability of carers, but also the service providers and researchers and others that work with carers and are interested in carer-related issues and policy. A quick note about format today. So those of you joining us last week will be aware that this series looks a little bit different from our usual webinar format. We're trying some different things, an early morning start to have people that can catch us at the beginning of their day, a bit more of a conversational style, less formal, a bit shorter, and we want to have these sit alone as really useful recorded resources that we can share. So we'll have probably a fairly small live audience today, but we're really wanting to circulate this recording as a resource to many others as well. So thank you for joining us, and feel free to share the recording once it's available with your colleagues. Welcome, Lukas, and would you mind introducing yourself and telling us a bit about your current role with Carers New South Wales?
Hello, yes, thanks, Sarah. I'm the Senior Research and Development Officer. Have been with Carers New South Wales for roughly 5 years now, which is a shocking long time. My background is in sociology, and before I came to Carers New South Wales, I was, like many others, doing my PhD and teaching at various universities in Australia and overseas. So I'm not originally from Australia, which gives me an interesting perspective on how things are run here. And I hope to leverage this outsider perspective a bit to generate some insights into how things work in certain aspects. In my day-to-day work at Carers New South Wales, I provide the policy team with research evidence, mainly from the other main project that I'm working on, which is the National Carer Survey. What else do I do from day to day? Provide the numbers, try to get the survey working, and I'm very glad that I can see. What I very much enjoy about my role is that I can see that the data that we're going to talk about today has been picked up in a variety of policy arenas already, and that our research through our policy team gets out there very efficiently and gets to the people that need to know about it. Whether these people act on it is a different story, but I'm here to talk about the research part of it, which is always very exciting.
That's great. And yes, we definitely appreciate your European perspective. Our policy and research team brings something a bit different to our usual sort of comparison countries when we're looking at different initiatives. So our next question, Lukas, I wanted to hear a little bit more about the key projects relating to Respite that you've been involved with at Carers New South Wales.
Like I already mentioned, one of my main projects, and surely the one where the most time goes into, is the National Carer Survey that originally was run as a statewide survey for Carers New South Wales. Sarah, you always mentioned that Carers New South Wales was funded on the basis of a survey in more than 40 years ago. And since 2000, I want to say 4, the survey has been done biannually, and even before I started here, progressively gained scientific rigor. So it's not just a simple survey where we go out and ask people what they think. We do that too, because it's an important aspect of that work, but we have sort of a scientific background to it. And since 2020, we run this survey nationwide with the collaboration of the other state and territory care organizations. And we're really trying to build the evidence base for our systemic advocacy and for our service provision through that survey. And Respite is, of course, a very important part of both our advocacy efforts and our service provision as well within the Carer Gateway. So 2020 and 2022 were the first 2 years where the survey was run nationally. We're going to run it next year as well in 2024. And we will take a slightly different approach to how we talk about Respite in that survey, because in the background, we do have a major project with Professor Mara Hamilton, Associate Professor Mara Hamilton from the University of Sydney, looking at respite care, replacement care, and sort of interactions, how carers can really get that respite effect. A lot of preparatory work for this was done in a different project where I was involved a bit more on the sidelines, but where I also provided data for, which is the Care Respite Alliance paper. I think we've got a link for that in the chat. That was published in 2021, and it was co-developed and led by the Carers New South Wales policy team in partner with the Care Respite Alliance. And a lot of the data that we got from the Carer survey got into there as well, but the paper is much more broader than just that. It presents sort of the history and the context of respite in Australia. Other than these two major respite-focused projects, I am also involved in reviewing service delivery data for Carers in South Wales as part of our ongoing monitoring and evaluation activities for the Carer Gateway services that we provide, and in the Central Coast and Hunter, New England, and North Coast regions of New South Wales. And we've got our own sort of respite projects up there where we try through holistic respite to slightly offer something a little bit different to the standard offerings of respite. And yeah, that's my respite related work, sort of looking at data and trying to figure out what we can say based on that data.
So plenty in short form, lots of work on respite and lots of analysis of respite data. Thanks for providing that overview, Lukas. Can you tell us a little bit about what prompted Carers New South Wales to have such a focus on respite in their research and advocacy activities?
Yeah, there's a broader picture behind that. And sort of if you look back, respite is an important thing for carers to get a break from the caring role. We know that, and carers keep telling us that. But sort of if we go look a bit back in the broader picture, less so much about services for carers and more about services for the people that they care for, there has been this shift towards consumer-directed care, and that has been taking place both within care for people with a disability, with the NDIS. This was probably the most pronounced shift, where sort of this idea of the consumer choosing their own care has been implemented, but also in the aged care space. In the aged care space as well, My Aged Care follows a consumer-directed care approach. And what has happened through that shift away from sort of general service provision to this very individual-focused way of providing services is that the focus, it's partly an unintended consequence, I think, but partly it's also on purpose, that with that focus on the consumer, the surrounding, the social surrounds of the consumer drop away from the perspective of the service providers, and that is the carers. And so with this shift, respite delivery has continuously disappeared from view, and that's especially true for the disability support sector. So we've got this sort of ideological shift, and that sort of sits on top of an operational shift where these services also have moved from the purview of the states and territories to more and more federalized delivery model and centralization of funding and administration. So what we've looked at over the last 10 years is sort of the separation of services of the people that require care and services for the people who care for those people. And yeah, so in around 2013, 2016, the carer organizations collectively became really concerned about the assumptions and the public discourse that happened in the wake of these shifts. And so they noticed that sort of messages and assumptions were put into the discourse that also problematized respite as an idea in itself, and that the notion became very popular that carers actually don't really want respite because they weren't taking it up as much as they expected, and that respite services, and this is a very problematic point, respite services wouldn't be effective in improving the lives of carers. And we knew, or our organizations, back then I wasn't part of this, but as an organization, we knew that that wasn't the case, and there's in fact a very big need of carers for respite, and that carers profit a lot from being able to take time out of the caring role, being able to focus on themselves a little bit, and yeah, that respite has a very important positive effects, which are, however, hard to demonstrate. So that was part of why sort of this respite paper that came out in 2021 and our work in the carer survey focused very much on respite, and where we tried to get everything together that we know about these issues in the background. Yeah.
Great. And how did that go? Were you able to find some new things? Were you able to demonstrate those ideas that you mentioned? What were some of the key findings?
Well, particularly in the survey, we found that carers articulated a very high unmet need for respite, a lot higher than in the official ABS statistics that we have around that. So, which is an interesting finding because our sample really looks at the pointy end of caring. Our sample is relatively big. So for context, our survey sample in 2020 was around 7,500 carers. In 2022, it was around 6,500 carers. And they roughly evenly come from caring for someone in the aged care space, caring for someone with a disability space, and caring for someone with mental health issues. So we look at all kinds of care out there that's provided. And we found throughout that there is a big unmet need for respite among those carers who already provide a lot of care. So what sets our sample a bit apart from other studies is that our sample is very big. I think it's the largest survey that's not an ABS survey that's capturing carers, and that's focused on carers. But it's also a little bit focused on carers with very intense, very long-term caring roles. And these are the people who really need respite. And so we, sorry. What we found in there is that carers who need respite and who haven't meet that really, really struggle in their caring roles. And while there is not a simple positive effect of people feel better when they have respite, they feel a lot worse if they don't have respite. And I think that's one of the main insights that we could generate through our survey data. And the respite paper more generally goes in much more detail than just the data, goes into sort of a lot more of the policy discussion, and really ends with a set of recommendations that give a really clear direction of what kind of policies we think in the respite space would be required to better support carers in Australia.
So the work that you've looked at kind of shows there is that demand, there is that uptake, and there is that effectiveness. Though maybe it's sort of a little bit tricky to measure in some ways, and I guess that's why we wanted to bring it to this session today. So what don't we know about respite? Are there some gaps in the evidence base that remain? What don't we know?
Well, what we've looked at so far with our surveys is we have a very general way so far we've approached respite in a very general way, which might be part of the issue because a lot of people who aren't carers and aren't familiar with the service speak and the jargon in the space don't know what respite actually means. But of those that's not true for our service sample. In our service sample, most carers would, because most of them are somewhat familiar with the offerings of services. We found in 2022 that around 11% of our carers used respite. However, that there was an unmet need of around 26, articulated by around 26% of all our carers, which is significantly high. And there's a small overlap of around 2 and a bit percentage points who said they use respite, but they do have an unmet need. And what we can show is if you have, well, there's no statistically significant difference in well-being whether you don't use respite and you don't need it, or whether you use respite and your needs are met. So respite in that doesn't improve, statistically significantly speaking, your well-being as a carer if you need it and you get it. What we can show is that those who don't have respite, and especially those who don't have respite at all but have an unmet need, fare significantly worse in all our outcome measures, and that includes well-being generally, that includes psychological distress, and that includes social connectedness. So there's a big effect that we can see that people who don't have access to the respite that they need, and that's an important thing. That sort of, if you articulate an unmet need for respite, they also struggle with making significant social connections and feel more socially isolated. And that in turn, there's a spiral hanging on that in turn negatively influences well-being and increases psychological distress. And what we're trying to do in the future with our more detailed research that we plan for the next year is get a bit further away from sort of looking at the pure service type and the pure service utilization and look a bit more on respite effects. What other options, what other avenues are there where we could look at how to give carers this effect of being able to take time out of their caring role, being able to recuperate their energy, being able to have a little bit of time for themselves to really make the caring role more sustainable. And I think one of the aspects that we will have to look at is interaction with formal services for the care recipient. So if it's not a service for the carer that is provided, but a service for the person that they care for, how can these services be provided in a way that the carer profits from them as well, and that give carers sort of that time out and that sort of capacity to mentally and physically recharge so that they can keep on caring when the formal services are not available. So that is something where, together with Myra Hamilton, we will look at into this a bit more. Another background thing is that there is a big gap in sort of consistent, detailed service use data on behalf of the providers. So we've got a very little administrative data about that, and we want to look in that too, because that would be the best data source that we could use. But we don't really, there's not really enough data out there to look at sort of this interaction and to look at the effects and the utilization of respite of carers in Australia more generally. Yeah.
Great, thanks for that. And I know it's sometimes hard to talk about some of these detailed findings without a visualization. So for those that do like that kind of level of detail, please do have a look at the reports that are linked in the chat for some complicated graphs and detailed findings. But it sounds like we've got a lot of evidence on the existing sort of respite service systems and unmet need, and I guess really the impact of those respite services on carers, maybe not so much to solve all of their problems, but certainly to keep them going. And that if people need it and don't get it, we're really seeing the impact of that negatively on them. And it's great to see, I guess, more directions, including this series, looking at some more innovative ways of looking at respite outside the traditional respite service system to see what works there, and also just getting that better integrated government data. I also wanted to address specifically, since our original speaker today was going to look at their work on measuring the value of respite, they were going to look at focusing on the economic value. But measuring the value of respite is something that we have addressed in some of our work on respite. So I just wanted to, I guess, ask you to specifically comment on that. What insights have come from your work about how the value of respite can or should be measured?
Yeah, so like I said before, typically when a service is provided to someone, the expectation of the funder is that that service will increase the well-being or whatever the desired outcome is. The problem with respite is that respite is often accessed by carers who are already in crisis. And what we find is that, like I said, there is no significant difference in terms of well-being and our outcome measures between those people who don't need respite and don't use it, and those people who do need respite, do use it and had enough, so to speak, had their needs met with respite. We don't see an impact there in our survey data. And that's just an example that many studies have shown have struggled with a similar effect, that they couldn't find sort of the positive effect. But since we know that respite is accessed when there's a crisis mainly, what we really can show is that it's the unmet need, that it's the absence of respite when it's needed, that really sort of deteriorates. So researchers need to shift their usual evaluative frame for these. And that's a really hard thing to do for the typical researcher, because the typical researcher uses carers who use respite services and carers who don't as a control. And this is an approach that doesn't quite work in the respite space. And we really need to shift, and we really need to design better approaches to measuring services that use that work sort of conserving rather than improving. And that's a big problem in the respite space. That respite is something that conserves the power at the moment, right? Respite is something that comes in a crisis and conserves the power of someone who provides care. I don't think it's necessarily that it needs to stay like that. I think respite can have a positive sort of increasing effect if it's done right. But we know, because of the scarcity of respite places, the problems in sort of arguing for an access to that, this is hard to improve. And this is something that maybe sort of future direction should look at, is how can we move respite sort of towards a way of provision that does more than just help overcome a crisis or stabilize someone before the crisis becomes really, really terrible. And yeah, that's one of the things. I mean, even within the current frameworks, I think the data is just very unclear around, is there a lack of efficient service provision? Is there a lack of awareness of the carers as well, what respite is, what it does, how it is available? Because the services, as we know, focus on the person that they care for and not on the carers anymore. And there needs to be better communication there, and there needs to be better studies around what can be done to support the carer to improve their well-being through an effect that gives them a respite effect rather than the formal service of respite. And I think sort of the Care Respite Alliance really thinks in that space more and more.
So we've heard some, I guess, areas for the research that are going to happen, but also that could be gaps for those that are involved in that side of things. For those that are joining us today that I guess want to take some practical steps to contribute to this bigger picture of respite or to apply some of these findings, what would you suggest as some next steps?
Yeah, so on the one hand, we have these beautiful reports. Some of them are even nicely layouted. Can I highlight the 2022 survey report? Make use of the data, make use of our arguments that we provide. Again, the Care Respite Alliance paper provides a set of recommendations that if you are a provider, you could look at. If you're a policymaker, you could look at how we think that respite could be improved. We're also happy if you have a project talk to us. We're happy to lend our expertise to any project in that space that you might be interested in running, and where you might need advice, or where we could help in any other way. So yeah, that's another thing that's possible to do. And then, of course, we need more data. So the 2024 Carer Survey will come out, and we'll look more detailed at some of the respite issues. Help us promote the 2024 National Carer Survey sometime June, July next year.
Excellent. And that is also a good segue for another action, which is to keep involved in this series of webinars. So before we throw up that promotional slide, I just wanted to again thank Lukas very much for stepping in at very short notice as today's guest interviewee, and for sharing with us some of the insights that his work has brought around respite. I might get Mel to pop up our slide just to bring your attention to the remainder of this webinar series. So we'll pause for now. Anyone that needs to jump off at 9 is welcome to, but if you want to stick around for another 15 minutes and hear Lukas respond to your questions, ask some more questions, you're welcome to. But I might just get that slide up. Excellent. We are not seeing the slide. There we go. All right. So just to draw your attention, I mentioned that our original speaker for today, Kim Whitmore, will try and get a date for a revised session with her probably in January, because we do have February, March and April speakers locked in as well. So just putting those dates up for you. We were going to put a registration form for our next session in today's information, but we're just about to have a big migration with our marketing system, and I don't want anything to be disrupted. So once that's completed by mid next week, we will send out registration information so that everybody gets that. And anyone that's registered for any of these webinars will get the information about others in the series, as well as recordings. But also, just if you want to stay in the loop about this and other sessions and you're worried about missing out, we always encourage you to subscribe for Carers New South Wales monthly e-newsletter, which has a sort of sector focus and will include any upcoming events for different stakeholders. So I'll get Mel to put the sign up link for e-news in the chat as well. That's a great way to stay up to date. But please do stay tuned for monthly webinars for at least the first few months of next year. As part of this series, we have some international speakers, some local speakers, some really interesting different perspectives on respite. If you have a speaker or a program that you'd like to highlight, I think this series would be great for, please do drop us a line, whether it's in Australia or overseas. We just really want to provide a platform to kind of inspire some innovative thinking in Australia around respite. So in terms of our last 15 minutes, we might just put those slides down again and address some of the questions we've had from the audience. So thank you for those that have put some questions in the chat. We will go in order to those that were posted. A question for you, Lukas, from Donna. Have you any research on the impact of respite on the care recipient?
That's a very good question, and it's always a very it's a very classic question, but I'm not aware of a study that has conclusively proven that. Like I said, the issue is the context in which respite is provided. But of course, what we do know is that carers who feel better about their caring role and who have the energy to provide better care, and better care has a positive effect on the person that they care for. So yes, there would be, I would assume that there should be a way of proving that. However, in our survey, we don't collect well-being data on the care recipient, because that's a very complicated study design, which we just don't have the resources for. But we would be very interested in looking into projects that would actually be able to provide that. There are some model projects where they go in that direction, and that sort of really think around the well-being of the person that they care for and the carer together, especially in the aged care space. There is a little bit of work out there that shows that, a well-rested, more energetic carer has a positive effect on the care for the care recipient. Yeah.
Thanks, Lukas. We had another question here from Di. How do you know who needs respite?
Well, in the survey we ask. In the survey we really saw, we asked two questions. Have you used respite? and do you have an unmet need for respite? That's the things that we ask. And so did you use it, or would you like to use it more than you did? Or if you didn't use it, would you like to use it? And we see that those who say, need to use it more, those are the ones where the well-being significantly is lower than consistently and significantly is lower than those who used it or those who didn't need it. So we ask about that. And it's within the remit of the carer to say, hey, I need some respite. So there is no objective threshold where we say, oh, you need respite. But generally, respite services should provide a relief for those who are in stress. So carers in stress need respite.
And you commented earlier, Lukas, on there being some sort of, I guess, divergence between some of the earlier government statistics around need for respite and ours being higher. Did you want to comment any further around, I guess, why that discrepancy? So why would our need statistics be higher?
I think it has in part to do with the type of question that is asked and with the sample. So because our sample is mainly carers who, through their caring role, have already in contact with carer services, they would know what respite is. And they would have been given the recommendation by someone who knows, hey, you need respite, or you need some services that are there for you. Whereas in the random population sampling that the Australian Bureau of Statistics employs, which is not a bad thing, the demand for respite is significantly lower. In part, that is because they are better at capturing carers with a lower caring load, who care for someone who needs less of their care. And the other thing is that a lot of carers who therefore haven't had access to carer services don't know what respite is. I mean, when I came into that space, it took me a while to wrap my head around what respite as a service type means and what it does. And I work in that space. So if you don't work in that space, if you never heard of the word respite, and someone comes to, do you need any of that? He said, no, I don't know what it is. So I think that there is what our data shows is that definitely for those with the high intensity caring roles, who on the other hand are most likely not in the ABS data set because they're too busy answering, doing their caring role, we do see that the need for respite is significantly higher than the official statistics suggest. Yeah.
That's great, thank you. Our last existing question in the chat, though we have some time to maybe address some others, so if anyone has any pressing questions, please do pop those in. A question from Adam: could respite for carers be considered a part of further work around family and carers leave for those carers who work?
Definitely, that's something that we're looking into. And that's a little bit where the project with Myra, I think, will look a little bit into that. The issue with respite at the moment is that carers who combine care and at the moment, the typical trajectory of a carer is carers start out providing care and working if they're in working age, and sort of with increasing care responsibilities, they reduce their work hours, and at some point they quit that job, and only then, when sort of they've already cut down on other commitments and their caring role keeps getting more demanding, only then a lot of them access services such as respite. And that's a problem. And that's something that definitely needs to change in order to keep people in work. The caring role needs to be, that there need to be more possibilities to combine work and care, and respite should, and I think will need to play an important part in that, with giving, moving away from carers only accessing services once they're in crisis. Sort of what would need to happen in order for a respite to play a bigger role in keeping workers, keeping carers in work, is that there needs to be a higher awareness of the availability of carer services, and there needs to be a higher willingness to provide services to carers who aren't already in crisis. and who aren't already struggling, in order to prevent sort of this deterioration. So this is a change that would need to happen in the approach to respite from a crisis-focused one to a preventative type of intervention. And yeah, there needs a lot of work to be done in order for that to happen.
That's great, thank you. In our last couple of minutes, I'll let others ask a question if you've got one that's sitting there, but we might also, I realised I forgot to ask Mel to launch our feedback poll earlier. So for those that are still around, if you could just have a look at the poll that will pop up on your screen shortly, just to give us very quickly kind of your thoughts about today's webinar format and content. So we've got one more question here from Andrew. Is there any information on the nature of effective respite in terms of amount, of ideal time, the average cost? Can it include the person they care for getting away together?
I don't have that information ready. I'm not sure. I think sort of the perfect amount of time would depend a lot on the individual situation of the carer. The average cost, I don't have that in my research. I'd have to look at our service provision data. I think though, yes, it is usually a very relatively expensive type of service because care for the person that receives the care needs to be organized and on a short term, so not ongoing, which comes with higher costs relative to ongoing care. So there's a lot of complexities around this question, and therefore I can't answer it. There's no easy answer. I think there is no easy answer to sort of what is the ideal amount of respite and what's the average cost. I think that varies very much depending on the individual caring situation. I think the important thing, though, is about the principle that carers should have access to the respite that they need, and that it should really, we're talking a lot about consumer-directed care. I think if we take that principle seriously, we should provide carers with the amount of respite that they need in order to keep caring with acceptable levels of well-being of their own. Carers tend to focus on the person that they care for much more than on themselves, and that's something that also is an issue when we look at something like respite.
Great, thanks, Lucas. We might start wrapping up since we haven't got any more questions in the chat, but I guess it's been great to hear that there's a lot of evidence really that shows, I guess, the demand, the need, the uptake for respite services. But I think what we've heard is that the limitations in the service data that exists and some of the challenges around questions and awareness have kind of curtailed a little bit some of what we know about respite, but also just hearing about the diversity of caring roles and the diversity of needs, and really that we need to be moving more towards a flexible, person-centered approach to how respite needs are met. Yeah, there's some great ideas in the chat as well that have come through. I might ask Mel to reshare those earlier reports that Lucas was referring to, the 2022 National Carer Survey report and also the 2021 Carer Respite Alliance paper for those that want to have a look bit more at the detail. We will be sharing this recording as well with all of you. And please do contact us at the research team at Carers New South Wales, research@carersnsw.org.au for any further questions. I'm sure Lucas would be more than happy to go into some of his more detailed graphs and findings with the more data-minded. And we really appreciate you joining us, especially with the change of plans at last minute. And we look forward to sharing with you the dates and registration details for our 2024 sessions before the end of the year. So thank you very much for joining us today. Thanks again, Lucas. And we will be in touch with the recording shortly.